We are the Koala team. My name is Valerie De Leon.
I'm Ubaldo Rodriguez.
I'm Dewanica Washington.
I'm Alexandra Vasquez.
I'm Shelby Allen.
Hello, I'm Shelby Martinez.
Hi, I'm Destiny Maxwell.
I'm Mohsin Yaqub.
Hi, I'm Juan.
My name is Andrea Betance.
We're here to talk to you about healthcare. I have a personal friend whose mother is frequently ill and she requires a lot of travel to get the medical care she needs. The closest hospital that can do this for her is in Houston, Texas, which is 5 hours away from where they live. So as a consequence, they have to drive to Reynosa, Mexico, where they can get quicker, affordable care in 25 minutes. But what if her mother didn't have 5 minutes? It would be really detrimental to any of their work if they could not get the care that they needed quickly. Obviously, something is wrong if this woman had to leave her own state to get the care that she needed. She should have had access.
Last year, I had the honor to meet one of the most intellectual and inspirational teachers that I've ever had. Part of the reason why I have so much respect for this woman is the way that she's able to deal with her disabilities. However, each month my teacher has to drive herself from Bronzeville to Houston, Texas, just to get the treatment that she needs. This 6-hour drive is not only an extreme inconvenience and burden for her, but it also takes away precious time that she could be spending with her family or doing the things that she loves, such as spending time at our school.
Yeah, and on that note, my 8th grade year, my mom was actually diagnosed with breast cancer. It was rather difficult for her to get access to health care. So she was forced to spend countless minutes that seemed to matter the most, traveling to see a specialist. I feel like if she had quick access to medical health care, she probably would still be here with us today.
And as you can tell by the experiences shared, the struggle and loss of their loved ones because of a fractured healthcare system, this has most certainly made a significant impact in their lives. They are not the only ones that have gone through this or have experienced this.
So obviously there's something wrong. Certain areas in Texas are heavily impacted by the lack of accessibility of healthcare, specifically Del Rio. In Val Verde Medical Center, the ratio of hospital beds to population is 93 beds to 50,000 people in the community, which means the hospital is only serving 18% of their population at maximum capacity. Residents in underserved areas are sometimes forced to drive 5 hours to the nearest hospitals. In addition, there are only 400 healthcare professionals in the area, which are spread between 1 hospital and 6 clinics. This issue is inhibiting the Texas healthcare system from further innovation.
In acknowledging the need for healthcare reform in Del Rio, we are here today to suggest a policy that would implement the People for Our People program. People for Our People is a pilot program that will create greater access to healthcare for patients in underprivileged and overpopulated areas by increasing the number of healthcare professionals in the Del Rio area. People for Our People is innovative and cost-efficient as a result of our year-long contracts solely with Texas healthcare professionals, along with our session-based pay schedules and salary incentives.
The People for Our People policy is fresh because it supplies medically undeserved areas such as Del Rio, Texas, with doctors and healthcare providers to existing establishments. Most people just want to open up new facilities, and most of the time they are unsuccessful. These healthcare professionals work alongside currently employed professionals who are already invested in making local hospitals and clinics better. We would develop partnerships with the hospitals to enhance their program, not take over. The end goal for our policy is to establish underprivileged regions with more sufficient and independent medical services by expanding and making healthcare more accessible in struggling counties throughout Texas. To start People for Our People, we would need $1 million to make this happen. In order to do this, we would raise local property taxes in medical districts in Del Rio from 0.125% to 0.15%. Raising taxes now will help people save money on medical bills in the future by bringing in specialists to help install more preventative care.
In order to implement our policy, we would need to create a staff that would be able to run the program effectively. The staff would consist of the original hospital staff and specialized healthcare providers from around the state. Following that, we would construct a needs assessment survey which would tell us clarify who we need, when we need, and where we need it.
After this, the process of recruiting doctors starts. They will work once a month for 10 months. In return, they will be paid $300 per visit that they make, plus $2,000 after they come complete up to 10 months each year. Once this is completed, we will orientate the individuals and the People for Our People policy will begin.
We are asking for your support today in voting for this legislation. But more importantly, we are asking you to show compassion for your fellow Texans. With your help, we can help heal the workforce and strengthen the economy. Healthcare accessibility throughout Texas is amongst the lowest ranked in the United States. Together, we can begin to instill an overall improvement of the Texas healthcare. Your vote today will determine the future growth of our state. So, we ask you to vote for this legislation. Thank you. Are there any questions?
Are you going to be providing any assistance to those in rural areas who do not have access to a medical clinic?
You see, Del Rio would be considered one of those areas that you're asking about, huh?
Because this
Yeah.
is a pilot program, it would be our initial place where we'd begin experimenting with this process and see how it would work. They are our little trial, our guinea pig. And when we did our research, we found out that they would need a lot of assistance. So by bringing in specialists from around Texas to fit their needs and come regularly, then it would improve their little clinics and hospitals that are currently there. Our program is not there to replace their jobs, but to provide them with assistance that they cannot get on their own.
You said that it would cost $1 million to fund your program. What would those $1 million be spent on?
Actually, the $1 million will be spent on the doctors, their, I'm sorry, giving them their profit of the profit. Also, giving them bonuses. They will get a $2,000 bonus from completing our program, and also supplies, and then also
Transportation. Also taken into account.
We would pay for travel expenses to get the doctors to Del Rio and back, and we would pay for the salaries, and we would pay for the supplies that would be needed in the hospital.
You said that you would raise some money by increasing taxes on the people of Del Rio. How would you deal with opposition from the people that live there? Like opposition to the taxes?
Well, the way we see it is that would you rather increase a tax now? It'll be 15 cents per $100, or would you like let your medical bills increase and become $100,000 or plus, and you be in debt?
Also, in the long run, people, the doctors would start to assimilate the economy in the place, which is Valverde County. And after that, if the program succeeds, we can now spread that program across all rural areas in Texas, and we would take back that that tax increase that we put in Valverde County and just leave it as it was before.
Would you have any organizations that would either, become your partners or maybe any opponents? And if so, examples of them?
The Texas medical centers, they would be very positive to this, in our opinion, because we're doing something that will help not only the people, but it kind of supports a more humanity side to things, because you're trying to help people and improve their longevity in the workplace and in their personal lives. So if we're doing something to help the better good of the community, then I think they'd be on board. Also, the Texas Rural Cares. There's
Association of Rural Hospitals will be on board.
They would definitely be looking forward to a partnership because they are the rural hospitals that do need assistance.
Some of our oppositions would consist of hospitals that we'd be taking their doctors away from, because we would also be taking health providers away from other local places that they'd be coming from, and also hospitals in the Del Rio area, because they may think that we're trying to take over, and other than trying to help and assist.
You guys talked a lot about Del Rio and all the areas around there. Do you guys plan on expanding and going to other different areas, or is that your central area? And if so, where would you go?
Because Del Rio is the origin of our pilot program, if it did do well, we would continue to expand throughout other counties in Texas. We would do a similar thing that we would do earlier, which is a general needs survey, and find out who wants to be a candidate, and we'd go and do further research on them. And if it is very successful, then it can be replicated easily.
Can
Well, we're not a free clinic. We would be accepting Medicaid and Medicare, and also if you didn't, then you would have to pay the tentative cost and the copay for using our clinic.
Our main purpose is to give the people from Del Rio accessibility quicker and
Not
Okay.
financing their health care.
You guys talked about expanding your program. If you did expand it, how would you fund it?
well, the money that we would be gaining from this program, we would use that money in order to expand the rest of the program in other rural areas.
Last question. Yes. Since they're rural areas, many of these families might not have the resources to attend your hospital. So if you don't have enough patients coming in, what would you do to pay your expenses?
Well, in Del Rio, there are actually 6 clinics and a local hospital there, so there are many facilities for them to get to. We are just adding in more providers so that they can be seen quicker and get the specialized care that they need.
It's a town of, sorry. Yeah, so it's a small town with a population of 50,000. Yes, one level 4 trauma center, 1 hospital, 6 clinics. So I mean, we won't have any problems with not meeting our needs. Yes.
Or having a client
Yes.
base.
These individuals will have the care that they need, and that's the important thing.
Overall goal.